Hey everyone, welcome back. Today we're diving deep into a heavy topic, one that's both super complex and deeply personal: voluntary euthanasia.
Yeah.
To help us navigate this tricky terrain, we're going to be turning to the Stanford Encyclopedia of Philosophy for some guidance. We really want to unpack the ethical layers of this very sensitive issue.
I think it's a topic that forces us all to really confront our beliefs about, life, death, and ultimately what it means to have control over our own destiny.
Absolutely. So before we jump into the heart of this debate, maybe we should start with some definitions, making sure we're all on the same page. I gotta admit, I sometimes get tripped up by terms like voluntary euthanasia, non-voluntary euthanasia, and physician-assisted suicide. Can you help us break down those terms?
Definitely. It's super important to be precise with our language here. So when we talk about voluntary euthanasia, we're specifically referring to a situation where a competent adult, someone who can make their own decisions, clearly requests to have their life ended. And this request is made to escape suffering that's caused by a medical condition. And the key here is the patient's informed and autonomous choice.
So consent is absolutely essential.
Yeah.
All right, what about non-voluntary euthanasia then? How's that different?
Okay, so non-voluntary euthanasia involves situations where the person is unable to give consent. Maybe they're unconscious or they lack the mental capacity to make that kind of decision, and they might not have expressed their wishes about end-of-life care before.
Gotcha.
So ethically and legally, it's a completely different situation.
That makes sense. And just to complete our little glossary here, how does physician-assisted suicide fit into this?
Okay, so that's where a doctor provides a patient with the means to end their own life. Usually it's a lethal medication, but the patient is the one who actually administers it, which is a key difference from euthanasia, where the doctor directly administers the medication.
Okay, so there are really important distinctions in how these terms are used.
Definitely.
And for today's deep dive, we're focusing specifically on voluntary euthanasia,
Right.
where the person is making a conscious, informed decision.
That's the core of our discussion today.
Now, the Stanford Encyclopedia lays out 5 conditions that are often considered necessary, almost like prerequisites, for someone to be eligible for voluntary euthanasia.
Yeah.
And they seem pretty strict, I gotta say. It's like a series of hurdles you have to clear. So why are these conditions in place?
That's a great question. And it's not about making things difficult. It's about ensuring that this practice is approached with the utmost care and responsibility, both ethically and legally. The conditions are there to prevent potential abuse and make sure the person's choice is genuinely autonomous and informed.
Okay, that makes sense. So what are those 5 conditions then?
Okay, so first, the person needs to have a terminal illness. Second, there's no reasonable chance of a cure for that illness.
Mm-hmm.
Third, they're experiencing either unbearable pain or a life that's become, unacceptably burdensome due to their illness. Fourth, they have a consistent and informed desire to die. It's not a fleeting thought.
Right.
And finally, they're unable to end their own life without assistance.
Okay, so those are the 5. But even if someone checks all those boxes, it's not a guarantee they'll be granted access to voluntary euthanasia, right?
Exactly. There are still, further evaluations and consultations with medical professionals to make sure everything is ethically sound.
I can see how those conditions help protect both the patient and the doctors involved. It's not just about an individual's right to choose, but also ensuring the whole process is done responsibly.
Yeah, absolutely. It's a complex web of considerations because we're talking about matters of life and death, so the ethical stakes are incredibly high.
Makes sense. But it also kind of raises a question for me. If we're really prioritizing a person's right to choose how they die, why have any restrictions at all? Shouldn't their autonomous decision be the deciding factor?
That is a question that sparks a lot of debate within this field. And you're right, some proponents of voluntary euthanasia argue that any restriction infringes on a person's autonomy. But I'd say the more common viewpoint, at least for now, is that some limits are necessary for a couple of reasons. Political feasibility is one,
Mm.
and also we need to think about safeguards against potential abuse.
So we're trying to find a balance between individual rights and these broader societal concerns.
Exactly. And remember, we're talking about changing laws and deeply ingrained social norms, which is, well, it's never an easy task.
Right.
So starting with cases where there's broad consensus situations like terminal illness with excruciating suffering, it just makes it more likely that these laws will gain public and legislative support.
So it's kind of a strategic approach, starting with areas of greater agreement and then building from there.
Exactly. And the second reason, the safeguarding against potential abuse, that's equally important. We have to consider situations where someone might be pressured into choosing euthanasia.
Right.
Maybe because of like financial burdens on their family or just feeling like they're a burden to other. And we also have to consider the possibility that someone's judgment might be clouded if they're experiencing severe pain or depression.
Yeah, those are all really important points. And it makes the need for safeguards even more apparent. But wouldn't those restrictions, in a way, kind of undermine the very autonomy we're trying to protect?
Yeah, that's the ongoing tension at the core of this debate, right?
Yeah.
Are we really honoring someone's autonomy if we place limits on it? So these conditions, things like requiring multiple consultations and a cooling off period, they're in place to make absolutely sure the person's choice is their own and not driven by external pressures or just a temporary emotional state.
So it's like this constant balancing act,
Yeah,
trying to find that middle ground between respecting individual choice and protecting people from potential harm.
exactly. It's a constant negotiation, and that's what makes this issue so ethically complex.
Okay, I think we've laid some important groundwork with those definitions and conditions. Now maybe we can shift gears a bit and explore the reasons why people support the legalization of voluntary euthanasia in the first place. What are the main moral arguments for this right?
At the very heart of it,
Mm-hmm.
the moral case for voluntary euthanasia rests on two key pillars: patient autonomy and well-being.
That makes a lot of sense. We've been talking about autonomy a good bit already. But in this context, it's about the individual's right to make decisions about their own life, their own death, right?
Exactly. People who advocate for voluntary euthanasia point out that, we already acknowledge a right to refuse life-sustaining treatment.
Right.
So the argument is, if someone can choose to stop treatment, even knowing it might lead to their death, why shouldn't they also have the option to choose a death that's more active, potentially less painful?
It's like extending the right to refuse treatment to include a broader right to choose how and when you die.
And that's where well-being comes in. When someone's facing a terminal illness with intense pain or a future filled with suffering, allowing them to choose a peaceful death can be seen as a profoundly compassionate option.
Right.
It's about honoring their desire to avoid further pain and loss of dignity.
So the core argument is that we should respect a person's right to choose and work to minimize their suffering. And voluntary euthanasia might be a way to achieve both those goals.
You put it perfectly, but as you might imagine, there are some pretty strong objections to this line of reasoning. And that's where things get really interesting.
Oh, I'm sure there are. It would be such a complex topic if there weren't compelling arguments on both sides. I'm ready to dive into those objections. What are some of the main concerns people have about voluntary euthanasia?
Okay, we'll get into the details later, but a lot of the objections focus on things like the availability of palliative care, as an alternative to euthanasia.
Hmm.
There are concerns about accurately gauging a person's, competence and their truly enduring desire to die. And of course, there's that age-old question about the slippery slope.
Sounds like we've got a lot to unpack there.
We do.
I'm ready to tackle those ethical dilemmas.
So we've talked about the core arguments for voluntary euthanasia, respecting autonomy and promoting well-being.
Right.
But as we hinted at, there are some strong counter-arguments, like, not everyone agrees with this. And the Stanford Encyclopedia outlines 5 key objections.
Okay.
Some of these, they dive into some pretty deep ethical and philosophical waters.
All right, I'm ready to test the waters.
Okay.
What's the first one we should tackle?
Well, let's start with the argument that that voluntary euthanasia might not even be necessary.
How could it not be necessary? I mean, don't people who request euthanasia usually have serious, often terminal illnesses?
That's a good question. And opponents of euthanasia, they often bring up advances in palliative care, They argue that we can actually manage pain and suffering effectively in most cases now. So they believe that with, really good palliative care, no one should feel like they have to choose death.
So it's the idea that if we just had better palliative care, the need for euthanasia would disappear.
Exactly. The claim is that, if we focus on improving access to quality palliative care, then the desire for euthanasia would just fade away.
That sounds, well, I can see why people would make that argument. But I imagine there are situations where even the best palliative care just isn't enough.
You're absolutely right. While palliative care is extremely important, we have to acknowledge its limitations.
Right.
The truth is, some people experience pain that's just incredibly difficult to manage, even with the most cutting-edge palliative care methods.
That's tough to think about. I can't imagine having to deal with that kind of suffering.
It is. And, it's not just physical pain. There are other types of suffering that palliative care can't fully address.
Like what?
Well, for instance, some people just find the loss of independence and dignity that often comes with terminal illness to be unbearable. They don't want to spend their last days completely reliant on others or, hooked up to machines.
Yeah, that makes sense. So even with excellent palliative care, someone might still have very personal and valid reasons for choosing euthanasia.
Absolutely. And the Stanford Encyclopedia makes another really good point. They say, even if palliative care could address all physical and emotional suffering, and that's a big if not everyone wants it.
Oh, that's interesting. Why would someone refuse palliative care if it could ease their suffering?
Well, there are a few reasons. Some people just don't want all the interventions that palliative care involves.
Okay,
They might not want to be on heavy medication or spend their final days in a hospital.
right.
Maybe they'd rather be at home with loved ones, having more control over the timing and the way they die.
It all goes back to that idea of autonomy, doesn't it? Respecting someone's right to make choices about their own care, even choices we might not agree with personally.
Exactly. And to back that up, the source mentions that studies have shown a significant number of people who request euthanasia are already receiving hospice care.
Wow.
So access to palliative care doesn't automatically mean people won't still want a more controlled death.
It's a really complex mix of factors then. Palliative care is important, but it's not a one-size-fits-all solution. Okay, what's the next objection on our list?
Okay, this one gets into some tricky territory. It's the whole issue of consent.
Ooh, yeah, I could see how that would be a challenge. What are the specific concerns about consent in the context of voluntary euthanasia?
The big question is whether we can ever be truly certain that someone requesting euthanasia is making a competent, enduring, and genuinely voluntary decision.
Right, I get that. Especially if someone is experiencing a lot of pain or fear or maybe even pressure from family members.
Mm-hmm.
How can we be sure their decision isn't being driven by those factors, instead of a true desire to die?
You've hit the nail on the head, and that's why all those safeguards we discussed earlier are so important.
Okay,
Multiple consultations, the cooling off period involving mental health professionals to assess for depression or coercion.
right.
These are all designed to really ensure that the person's choice is truly their own.
So we're building in a process that both protects the person's right to choose and acknowledges that their judgment could be impacted by their circumstances.
Exactly. And there's another tool that can be helpful here, advanced directives. Those are often called living wills.
I've heard of those, but I'm not sure I totally get them. Can you refresh my memory on how those work?
Sure. A living will allows you to basically spell out your wishes for medical care ahead of time,
Okay,
just in case you become incapacitated and can't make those decisions yourself.
right.
So someone could specify in their living will that they would want the option of euthanasia if they, developed a terminal illness and met certain criteria.
That makes sense. It lets people take control of those end-of-life decisions early on.
Right.
That way, their wishes are honored, even if they can't communicate them later.
Exactly. It gives people a way to express their values and preferences while they're still fully capable. But even with all these safeguards, some critics of euthanasia might still argue that, well, we can never truly know what someone would really want if they were actually facing death.
Right.
They might say some views could change once they're in that situation, and their previous wishes might not apply anymore.
That's an interesting point. It almost feels like a philosophical question, like how much weight do we give to someone's earlier wishes, knowing that, their perspective could shift in the face of a life-altering event?
It's a tough one, and there's no simple answer, right?
Right.
It boils down to how much we trust people to make informed decisions about their own lives, even if those decisions involve the possibility of future regret.
Yeah, I see that. It makes us think about the nature of economy and how hard it is to predict how we'll feel in certain situations.
It really does.
Wow, this is getting pretty deep. No easy answers here, that's for sure. Okay, I'm ready for the next objection. What else do we have on the list?
All right, this one is called the doctrine of double effect.
The doctrine of double effect. Okay, that one sounds complicated. I'm going to need some help with this one.
It is a bit of a head scratcher, I'll admit.
Yeah.
But it's a concept that's been around for centuries. It's often used in discussions about medical ethics.
Okay.
Essentially, the doctrine of double effect says it's okay sometimes to do something that has both a good and a bad effect, as long as your intention is to achieve the good effect and the bad effect is an unintended side effect.
Okay, I'm trying to wrap my head around that. Can you give me an example? I'm kind of a learn by example kind of person.
Sure. Imagine a doctor giving a patient a high dose of pain medication, knowing that it could speed up the patient's death. According to this doctrine, that could be morally okay if the doctor's intention is to relieve suffering and the hastened death is just a side effect.
Okay, so it's about the intention behind the action, not just the result. But how does this tie back to voluntary euthanasia?
Well, opponents of euthanasia sometimes use this doctrine to draw a line between palliative care and euthanasia.
Hmm.
They might argue that palliative care, even if it has the side effect of speeding up death, is morally okay because the goal is to relieve suffering. But with euthanasia, the intended outcome is death, even if the motivation is good.
But the person dies in both cases, right? So how can intention be the thing that makes one right and the other wrong?
That's the problem a lot of ethicists have with this doctrine. Proponents of euthanasia say if the outcome is the same, a peaceful death for someone suffering, the intention shouldn't be the only thing that matters.
So maybe the focus should be on relieving suffering and respecting the person's wishes, regardless of whether death is the intended outcome or just a consequence.
Right, and the Stanford Encyclopedia, they raise another issue with the doctrine of double effect. They question whether death is always a bad outcome.
Oh, interesting.
Especially when someone is enduring horrible suffering.
Right.
They argue that if someone is choosing death to escape a life that has no quality, death might actually be a benefit, or at least, not a bad thing.
That's a really different way of thinking about death. Instead of avoiding it at all costs, maybe in some cases, it's a release from suffering.
It is. It's a very complex view,
Yeah.
and it shows how hard it is to apply these strict ethical rules to situations that are so personal, so subjective.
I'm definitely seeing how the doctrine of double effect might not work in this debate. All right, I'm ready for the next objection. What else do critics bring up?
Okay, this is a classic one, the distinction between active and passive euthanasia. Have you heard of that?
I have, yeah, but to be honest, it's always confused me a bit. Like, where exactly is the line?
Yeah, a lot of people find this distinction unclear and, not really helpful. But basically, the idea is that there's supposed to be a moral difference between actively doing something to end someone's life and passively allowing them to die.
So I'm guessing, like, giving someone a lethal injection would be active, while withdrawing life support would be passive.
Yeah, those are the examples you usually hear. And the traditional view, the one often held by those opposed to euthanasia, is that passive euthanasia can sometimes be okay, but active euthanasia is always wrong.
But in both cases, the person still dies. Why would one be considered morally acceptable and the other totally wrong?
That's exactly the point many ethicists are making. They say this distinction is more about words than a real moral difference.
Okay.
For example, what about pulling the plug on a respirator? Is that an action or just letting something happen?
Right.
Or what about withholding food and water?
Yeah.
Even if we call them passive, those actions can directly lead to death.
So the line between actively doing and passively allowing is super blurry, especially in end-of-life care.
Exactly. When you look at the outcome of the person's death, the distinction seems, less important. And there are cases where active euthanasia might actually be the more compassionate choice.
Really? How so? Can you give me an example?
Sure. Imagine someone with a really painful illness, someone who needs a ventilator to breathe. They've said over and over that they want to die, but they can't end their own life.
Okay.
Taking them off the ventilator, even if we call it passive, might actually prolong their suffering. But a lethal injection could be much faster and more peaceful.
So in that case, wouldn't active euthanasia be more in line with what the person wants and their desire to avoid suffering?
That's the argument many ethicists are making.
Yeah.
And it makes us rethink the idea that all forms of killing are wrong, especially in medicine, where the goal is to relieve suffering.
This is really making me rethink some of my own assumptions about all of this. Okay, I think we're ready to tackle that last objection we talked about, the one that comes up in every tough ethical discussion, the slippery slope.
Ah, yes, the slippery slope.
Yeah.
It's a powerful argument, but we need to look closely at it and see if it really holds up.
Let's do it. I'm ready to examine that slope. Where do we start?
Well, let's start with what slippery slope even means, right?
Yeah, good idea.
It's the idea that, if we allow A to happen, then B will definitely follow, even if B is something bad. So with euthanasia, the argument is that if we legalize it, we'll end up with non-voluntary euthanasia or, people being pressured into choosing death.
Yeah, that's definitely a scary thought. And then people bring up those historical comparisons.
Right. It's hard not to think about them.
It is.
People opposed to euthanasia, they often point to what happened in Nazi Germany,
Right.
as an example of what can go wrong. But is that comparison really fair? Is it relevant to voluntary euthanasia? That's what we need to unpack.
Okay, yeah, let's unpack that. I mean, on the surface, comparing voluntary euthanasia to the Nazi program seems really problematic. Those were totally different situations with different motivations and outcomes.
Right, exactly. The Nazi program was based on a horrific ideology.
Mm-hmm.
It's aimed at eliminating people they considered undesirable. It had nothing to do with respecting choices or relieving suffering or providing compassionate care.
It seems like bringing up Nazi Germany is more about shutting down the conversation than engaging in a real debate.
Yeah, I think that's a valid point. It's a way to derail the conversation by using a really emotionally charged event that's, while it was truly awful, it's not really comparable to what we're talking about.
Okay, so we can set aside that comparison. But what about other slippery slope arguments? Are there any that are more convincing when we talk about euthanasia?
There are a few variations, and it's important to, tell them apart. Some slippery slope arguments are based on logic, saying that if we allow A, then B must logically follow. Others are more psychological. They say that allowing A will make us more likely to accept B, even if there's no logical link.
Okay, so what would a logical slippery slope argument look like with voluntary euthanasia?
One version might be if we let people choose death when they're terminally ill and suffering, then we have no logical reason to deny it to people who are suffering, but not terminally ill.
Yeah, I see the logic there. If it's about easing suffering, why should it matter how close to death someone is?
That's the point they make. But supporters of euthanasia would say there's a clear distinction between those two cases.
Okay,
With voluntary euthanasia, the person is already dying, right?
right.
We're talking about letting them choose how and when they die, not whether they die.
It's about honoring their autonomy in a situation where death is going to happen anyway.
Exactly. But with non-voluntary euthanasia, we're ending the life of someone who could keep living. And that's a different moral question altogether.
Right, there are a lot more concerns about the sanctity of life and the potential for abuse in that scenario.
Definitely. So the logical slippery slope argument, it doesn't really work here because there is a difference between voluntary and non-voluntary euthanasia. But what about that psychological slippery slope?
Yeah, that one seems tougher to argue against because it's about, like, predicting how attitudes might change. What would that look like in this context?
Well, the argument is that once we get used to the idea of euthanasia as an option, we'll become, less sensitive to it.
Okay.
And then maybe we'll be more willing to use it in other situations, even ones that don't fit the original criteria.
So the concern is that we might start seeing death as a solution more often, both individually and as a society. And that could lead to us justifying it in cases where we wouldn't have before.
Yeah, that's the fear, and it's a legitimate one, but here's the interesting thing. There's actually evidence suggesting that this slippery slope hasn't happened in places where euthanasia is legal.
Oh, wow, really? I would have thought legalization would lead to, like, looser criteria and more non-voluntary cases.
It's a common assumption,
Yeah,
but the data doesn't support it.
okay.
The Stanford Encyclopedia mentions studies from the Netherlands and Oregon, places where, euthanasia or physician-assisted suicide have been legal for a while.
Right.
And those studies didn't find any evidence of more non-voluntary euthanasia,
Wow.
or that they've expanded the criteria beyond what they initially set.
So the slippery slope hasn't happened there.
Not so far, and it's important to remember that both the Netherlands and Oregon, they have strict safeguards in place,
Right.
to prevent abuse. They track the cases, review each death, and look for signs of coercion, anything improper.
So it's not just about making it legal, it's about making sure it's done ethically and with lots of oversight?
Exactly. Transparency and accountability are key. And it's also good to keep in mind that even where euthanasia is legal, no doctor has to participate. They can refuse if it goes against their conscience.
Right. So it's about giving patients the option while also respecting doctors' autonomy and judgment.
Absolutely. So when you consider all the evidence, that slippery slope argument, while it's emotionally powerful, it's not strong enough to justify denying people this option, especially when they're facing such awful suffering and have made a clear choice.
This whole conversation has been really eye-opening. We've talked about definitions, arguments, ethical concerns, and the safeguards involved.
It's a lot to take in.
It is, but it's been so helpful to delve into these complexities.
I agree. And the Stanford Encyclopedia, I think they hit on a really key point. At the heart of this debate are some of our most fundamental values. What does it mean to live a good life? What does it mean to die with dignity?
Right.
It's not about finding simple answers. It's about having these thoughtful conversations, grappling with all the nuances of a complex issue.
It's about realizing there are valid perspectives on both sides.
Mm-hmm.
And the answers aren't always black and white. It ultimately boils down to a question of trust, doesn't it?
Yeah.
Do we trust people to make these incredibly difficult decisions, even when those decisions involve choosing death?
That's a really powerful question.
Yeah.
And it's one we all have to grapple with.
We've covered a lot of ground today, but, this is just the beginning. The sources we've discussed, they raise even more questions.
Right.
About the meaning of suffering, the role of choice in our lives and deaths. I hope this has encouraged you to think critically about this topic.
Absolutely.
And form your own opinions.
And to our listeners, as you continue to learn about this, keep asking questions.
Yes.
Keep grappling with these complexities.
Stay curious, keep learning, and engage in those hard conversations. Until next time, thanks for diving deep with us.
So yeah, we've talked about the Nazi Germany comparison.
Right, and why it's not really a fair comparison.
Yeah, it's not. But, you mentioned there are other types of slippery slope arguments, right?
Yeah, you said there's the logical slippery slope and the psychological slippery slope.
Exactly. And people who worry about the slippery slope, they often bring up these two main types.
Okay, let's break those down one by one. What does a logical slippery slope argument look like when we're talking about voluntary euthanasia?
Okay, so a logical slippery slope argument would say, like, if we allow A, then B has to follow, just logically. Like, there's a flaw in the reasoning. So in this case, it might go something like, well, if we allow voluntary euthanasia for people who are terminally ill, then how can we say no to people who are suffering but not dying?
I see. Yeah. If the main idea is to stop suffering, why does it matter if someone's close to death or not?
Right, that's the question they raise, but people who support euthanasia would say there's a big difference between those two situations.
Okay.
With voluntary euthanasia, the person is already dying. It's not about whether they die, it's about letting them choose how and when.
So it's about giving them control over the end of their life when death is already inevitable.
Exactly. It's about letting them write the last chapter of their story, so to speak. But when we talk about euthanasia for people who aren't terminally ill, that's a whole other thing ethically. We're talking about ending a life that could go on for years. And that brings up concerns about like the value of life and the possibility of people being pressured or coerced.
Yeah, it does seem like a very different situation. There's a big difference between, like, honoring someone's wishes when they're already dying and making the decision to end a life that could potentially have a lot more time. So the logical slippery slope doesn't really apply here because there is a clear difference between voluntary and non-voluntary.
Right. It's not just a random line we're drawing. There are ethical reasons for that distinction. But then there's that psychological slippery slope, which is...
Yeah, that one seems a bit harder to debunk because it's about predicting how people's attitudes might change. So in this case, what would that argument look like?
Well, the worry is that even if there's no logical reason why legalizing voluntary euthanasia should lead to more non-voluntary cases, maybe just the fact that we start seeing death as a solution, it changes our attitudes and makes those other things more likely.
I see. So the concern is that we might become desensitized to the idea of ending a life, even if it's done with good intentions. Like it becomes more normalized, more acceptable.
Yeah, and that's not a totally crazy fear. It's something to think about. But the data from places where euthanasia is already legal, it doesn't seem to back that up.
Wait, really? That's surprising.
It is.
I would have thought those places would have seen more non-voluntary cases or, people pushing the boundaries of who qualifies.
It's what a lot of people assume,
Yeah.
but the studies don't show that. The Stanford Encyclopedia, they talk about studies from the Netherlands and Oregon, places where this has been legal for a while now. And those studies haven't found any evidence of a big increase in non-voluntary euthanasia, or that they're like loosening the rules about who's eligible.
So it hasn't become a slippery slope in those places.
Not so far, and it's worth noting that both those places, they have really strict rules and procedures,
Right.
They keep track of everything, review every case, make sure there's no coercion, no funny business going on.
So it's not just about legalizing it, it's about putting systems in place to make sure it's done right.
Exactly. Transparency and accountability are super important. And another thing to remember is even where it's legal, doctors don't have to do it.
Oh, right.
They can say no if it goes against their beliefs.
So it's about giving patients the option while also protecting doctors' right to choose.
Yeah, it's about finding that balance. So when you look at all the evidence, that slippery slope argument, even though it's a powerful image, it's not really a good enough reason to deny people this option, especially when they're going through so much and they've made a clear decision.
This has been such an amazing conversation. We've covered so much.
Yeah.
Definitions, the different arguments, the ethical stuff, the safeguards.
Lots to think about.
It is. But it's been so valuable to really delve into all this.
I totally agree. And, the Stanford Encyclopedia, they say something that really stuck with me. This whole debate, it really comes down to some of our most basic values,
Mhm.
What does it mean to live a good life? What does it mean to die with dignity? It's not about finding easy answers. It's about really thinking about these things and wrestling with the tough questions.
It's about recognizing that there are good points on both sides, and it's not always clear-cut. And maybe, at the end of the day, it's about trust.
Mm-hmm.
Do we trust people to make these incredibly difficult choices, even when it comes to choosing death?
That's a deep question.
It is. We've covered a lot of ground today, but really, this is just the start. The stuff we've talked about, it brings up even more questions.
Yeah, it does.
About suffering, about choice, about life and death. I hope this deep dive has given you some things to think about and, encouraged you to explore these issues more on your own.
Definitely. To everyone listening, keep learning about this, keep thinking about it,
Yeah,
and talk about it. Have those tough conversations with people you care about.
this is hopefully giving you a good foundation for those conversations.
I hope so. Thanks for joining us for this deep dive into the ethics of voluntary euthanasia. It's been great talking about this with you.
And to our listeners, thanks for being here. Until next time, stay curious and keep those minds working.